This is part B in our understanding of the allied health assistant workforce and the principles for successfully implementing allied health assistants into your model of care or into your setting. The learning outcome remains the same, and from this presentation, it's simply to understand the allied health assistant workforce. In particular, we're going to be focusing on the drivers, why they're introduced, and the kind of impact that they can have. These are the key drivers that we have found over the course of around 15 to 20 years of examining the allied health assistant workforce. The two key drivers for introducing them into any setting are because of allied health workforce shortages and/or a growth in demand for allied health services. These then identify as workforce and service level drivers. As you know, in rural and remote settings, we struggle with this one completely. We know that one of the core workforce drivers for introducing allied health assistants is because we struggle to provide allied health services with an already stretched allied health professional workforce. The second workforce driver that's been identified in the evidence base is that people are wanting to introduce these roles to allow practitioners to focus on more highly skilled areas of practice and delegating unwanted or more routine tasks. It's a really important driver to consider. We also know that this driver is influenced by the career opportunities that are open to allied health professionals. The more career opportunities and specialised roles that allied health professionals can undertake means that they can delegate more tasks to allied health assistants. And as we see a bit later, this has a large impact on how effective the assistant workforce can be and also the satisfaction of the workforce. Finally, we come to service level drivers. This is the other core reason why services and organisations introduce allied health assistants, and it's around opportunities for efficiencies with providing care. Recently, we've seen though that has been reoriented around providing more client or patient-centred care principles. I'll come to that in a minute as to why that's really important, but certainly consider what driver it is as to why you want to introduce allied health assistants into your workforce. Does it reflect any of these? Again, over the many years of investigating allied health assistants, these are the core areas that we know that allied health assistants impact, and they're very well evidenced, as you can see by the number of references here. We know that allied health assistants are very good at increasing service capacity, and they can do that by allowing the whole team to provide more direct care to clients, to release allied health professionals so that they can do more quality improvement activities and staff development activities. They also, in some cases where there is a specialised career pathway, allow allied health professionals to pursue more advanced career opportunities. We know that allied health assistants improve the continuity of care within the service, they improve client outcomes, and they ultimately provide a greater level of flexibility in the workforce. We've been through this already in the first presentation in this module, and we understand that because allied health assistants are not regulated, then their roles can uniquely fill service gaps that you might have in your organisational service, and in doing so, allow you to better meet the needs of clients when they arise. It is this, combined with some of the attributes of a support worker or an allied health assistant, that allows them to be able to improve client outcomes. We're going to focus a little bit on this statement here though. Allied health assistants are exceptionally good at delivering more and better client-centred care. The reason why they're able to do this comes down to some of their core attributes. We've seen this over the years play out time and time again, where a support worker or an allied health assistant uses these core attributes to influence positive outcomes with clients and better service integration for your team. The core attributes of AHAs, as outlined in this graphic and in this reference here, which is at the end, are that allied health assistants are mediators, helpers, companions, and monitors. We're going to be going into quite a bit of depth on these when we talk about recruitment of allied health assistants. So please focus on these when we get to that module. But in essence, what I'm trying to say here is we've talked about how allied health assistants are able to influence patient outcomes or client outcomes because their role is flexible. Their role is dictated by the context in which they work, and we've seen that slide in the last presentation. The context in which they work is dictated by perhaps the rurality of your setting, the types of practitioners in your team, the types of tasks that are delegated to that AHA. But what remains steady for most allied health assistants are these 4 core attributes, and we're going to call them generic skills. And what we know about those generic skills is that it's those skills that can influence client outcomes and can influence your connectedness of care and client-centered care, as well as the technical components of the work. And it's the technical components of the work that comes from your context, where your context is defined by who is in your team and what skills and knowledge they have and how they impart that to the allied health assistant. So in summary, we know that better client outcomes are associated with putting the client at the centre of the new model of care rather than the practitioner. And as we've seen, when you have support workers, providing these core attributes and these core interventions to your clients, you are able to reflect some of your client needs and matching them with the allied health assistant and what they can offer. And that is why they can influence client outcomes. We know that the impact of an allied health assistant is influenced by these things. Firstly, how well their role is defined. We know that ambiguity around the roles of allied health professionals and assistants leads to variation and ambiguity in delegation, and therefore variation in the utilisation of allied health assistants. If we reflect on the last presentation, we talked about some of the key workforce issues affecting allied health assistants, and we talked about underutilisation and the fact that allied health assistants can't transfer their skills from one setting to another. This is a core reason why. We also know that how effective an allied health assistant is to do with whether or not they're working to their full scope of practice. That is the same for allied health professionals. The more they can work to a full scope of practice, the more consistently they can delegate roles to allied health assistants. The more allied health assistants are working to their full scope of practice, the higher their level of satisfaction is with their role and less intention to leave. We also know that the impact of allied health assistants is influenced by how well client needs are matched to AHA capability. This is a really important one. Susan and I both understood this very well in the UK when we looked at multiple teams of allied health assistants working with AHPs in community settings and working with older people. We looked at the needs of the older people and how well that predicted when an allied health assistant would become involved. We did see some good patterns, and the services over in the UK were doing this well. But we know that if the client needs exceed the capability of the AHA, then impact is going to be compromised. The quality, frequency and structure of allied health assistant to allied health professional communication is vital in influencing the impact of the assistant on the client. This comes back to the roles that were identified in that previous slide, in particular the monitor. Allied health assistants are exceptional at monitoring clients, but unless there are really good communication structures between the assistant and the health professional, that role is compromised, and that communication channel whereby the assistant can advocate for and update the allied health professional on changes in client needs or in the client status is compromised, and therefore the allied health professional cannot designate how the intervention or therapy might be changed so that the client can still gain good outcomes and achieve their goals. We also know that impact is influenced by the amount of time for client interaction and also the quality and frequency of supervision and professional development provided to both allied health assistants and allied health professionals. The core reason why allied health assistants are impactful or not boils down to often the unwillingness of AHPs to delegate parts of their role to an allied health assistant. This is related to a lack of clarity around overlapping roles, a lack of understanding of how to delegate, lack of education, supervision and frameworks to support delegation, a lack of trust, and turf protection. I wanted to finish with these two slides which demonstrate the impact that some of these things can have. We know that greater staff satisfaction is associated with role clarity. Role clarity also influences the impact that the assistant workforce can have on client outcomes. We also know that sustainability of allied health assistant roles is associated with codification of the practices, processes, and training used to implement and manage the role. We've already discussed that codification means when you document all the processes and practices required to manage the role. So if we reflect back on this slide here, we know that when tasks are clear and codified and delegated appropriately, this will impact on client outcomes, it will impact on staff outcomes, and it will impact on the sustainability of the role within your setting.